Hello, I'm Treasurer Brad Briner. Today, some big decisions were made by the State Health Plan Board of Trustees that impact your health plan benefits. I want to share with you what they mean for you and your family. First, a change that won't happen until 2028, but is important for you to know about today. As you know, the state health plan has a third-party administrator, currently Aetna. It also has a pharmacy benefit manager, currently CVS Caremark. With contracts expiring at the end of next year, we completed a competitive bid process. Today, the board approved both contracts and awarded them to Blue Cross of North Carolina. Beginning in January of 2028, Blue Cross of North Carolina will be both our third-party administrator and our leading partner for pharmacy benefit management. Stay tuned for more information on those transitions. The next decisions made. Your 2027 benefits and premiums. As we've communicated, keeping things the same or status quo hasn't been working and is how we ended up with a $507 million deficit last year. We made significant strides in closing that deficit. And I know those changes, which included increasing your premiums and benefits, affected household budgets across the state. It's not lost on me that many of you are struggling to combat rising costs in many of your everyday necessities. And I understand that any increase in what you pay for your healthcare matters. After a year of negotiating with providers and others in the healthcare industry, we have some good news for you. In January of 2027, we will be implementing a new tiered provider network. Take a look at this chart. This is something new. In 2027, we will have preferred providers, access providers, and non-preferred providers. What does this mean for you? Under this approach, members who use preferred providers will pay lower deductibles, lower copays, and will have lower out-of-pocket costs than they are paying this year. For any of you who have been longtime state employees, you may remember that your costs were much lower in 2012. This preferred provider tier is very similar to what you paid out of pocket over a decade ago. Access providers make sure that where you live doesn't mean you don't have affordable options. Generally, these will be in place to maintain care options in rural and underserved communities. Access providers will be assigned costs that are generally similar to, or in some cases lower than, what you pay today. Non-preferred providers are higher cost providers. Simply put, you will have to pay more if you want to see a non-preferred provider. The board vote today approved that beginning January 1st, 2027. UNC Health and Novant Health will be preferred providers. To be clear, the addition of these hospital systems is in addition to the current network of preferred providers, which are generally independent primary care providers that many of you already go to. This is a different approach, where we're creating competition for providers and incentives for our members. The only alternative to place us on a more sustainable path would entail across-the-board increases to everything, and we really didn't think our members could or should be burdened with such an increase. The board also approved premiums for 2027. While nobody likes paying more, these small adjustments were necessary to help keep the state health plan financially sustainable and avoid even larger costs in the future. For individual coverage, monthly increases range from less than $2 to $8 for individual coverage. I know change can create questions and concerns. We have 3 months before open enrollment, and you will be hearing from me and the state health plan team a lot between now and then. We want to make sure you have clear information, updated provider directories, decision support tools, and resources. And we are always here to help answer your questions. Our goal is simple: keeping you healthy. That means preserving a strong state health plan, improving affordability whenever possible, and making sure you keep your access to quality care for the people who serve North Carolina. Thank you for all that you do for our state, and thank you for trusting us to be responsible stewards of your health benefits.